Stanford Erickson, editorial director of Chiropractic Economics. I'm here with David Williams, and you're the president and CEO of registerpatient.com.
Yes, sir.
Now, the company's been around about a year, I understand, and tell me a little bit why doctors of chiropractic should want to know about your company.
Well, what it allows us to do, allows a doctor to do, is to take their patients and have them register in the patient's living room instead of the doctor's waiting room. Being able to get all this information ahead of time prior to the patient actually getting there is ideal for you guys, for the chiropractic physicians' offices to have all that information ready. Typically, when you have an appointment for a patient, you tell them to be there at 10 o'clock. You say come in 30 minutes early. That information is not available. Well, they get there typically at 10. That's what they remember. So they kind of set your schedule behind. But the thing we do in there is we not only collect all the information that the doctor needs. So we collect the demographic information, emergency contact, allergies, medications that the patient's on, history, everything you need for a level 4 demographics for billing purposes. The nice thing about it is it's done, as I say, electronically at the patient's home. It's all web-based. There's no software to download. So all they do is sign up for an account on our system and allows that to happen. We only do one thing. We do patient registration. We do, however, provide an HL7 interface so we can import the data as well. There's 3 different ways that patients can actually come in and get the information, get started. From the website itself right here, they can actually go in there and be able to send the information from the doctor's dashboard, a request to the patient electronically. They sign that, they click on that link, and that sends them directly to the patient registration. You'll notice up here that it's got the green bar on it. It's the highest level of security that you can have through an encryption process. It's very safe, it's HIPAA compliant, and as I say, it's all done web-based, so there's no software to buy. The other thing we do nicely as well for physicians is we make it so that there's interfaces that are animated on our websites. So for instance, in this case right here, you can see on the screen, you can actually point to a particular area, take that area, input that particular area, and enter information on it. Basically, the pain level, the intensity, the quality of pain, and all that information is collected for you, and it's collected basically at the bottom of the sheet. You can see all the other ones that we've had done here previously. Then that information is actually taken from a net object and sent into put into a PDF format, which can be downloaded by the physician from the physician's office. So it takes all that worry of having the patient have to do it the way they used to do it previously.
But it also helps for insurance purposes then, is that not so?
Absolutely, because the billing for chiropractic, I'm not as comfortable with as I am with the medical thing, but you have to have a certain level of information that you're able to provide to the insurance company for your billing. Typically, a lot of doctors do what they call downcoding because they're not willing to have the patient sit in the office and fill out all that information that they're required, like your family history, your social history, all those things that a normal doctor wants. So you're not going to send your patient back and say, I need this now because I'm going to bill at this level. But we do it all in the first pull. When the patient comes in, they can do it at home. They got their medications, they know their history. They usually do it between 7 and 8 o'clock at night when it's the most convenient for them, and that's the way that should be done. It's going to be, I think, in the future, patients want this. This has become a patient-centric, opportunity for the doctors to say, hey, I recognize my patient's time. They can do it at home at their convenience, and that's kind of what we're doing.
If the doctor of chiropractic wants to interact with you, how might they do that?
Well, they can simply just go on to our, in which case you're talking about?
If they want to learn more about your company.
They can just go to registerpatient.com, click on there. There's all kinds of information, how it works. There's even a return on investment calculator in there. They can sign up for a 90-day trial for free. We have a coupon code over there. It's RP for free. RP for free. Isn't that right? Yeah, RP for free. And you can sign up on that for a 90-day free trial. If you don't like it, we don't do a long contract. It's a month contract. We do it monthly. If you're not satisfied with the service, you just quit paying.
Thank you very much, Mr. Williams.
Thank you, sir. I appreciate it.